Welcome to Great Smile Dental. I'm Dr. Shambach. I'm here with my colleague and friend, Dr. Schwartz, and today we're going to talk about Great Smile Dental's 3 options for patients whose teeth are no longer salvageable. Dr. Schwartz, could you go into those 3 options?
Essentially, we can start from the simplest. Our least expensive option are standard dentures, essentially your grandfather's dentures with the upper that has a palate and a flange. There is some motion to this setup, and also these must be removed at night and preferably after each meal. Now, our lower arch, in every single case, we always require anchorage. We no longer have suction. We have the tongue. The tongue displaces the denture. You can't eat without something. And we place implants on the bottom to anchor our lowers. Our second stage we call semi-permanent. We take the concept of the implants that we have for the lower and essentially put it on a bit of a steroid treatment. We basically put anywhere from 4 to 6 and sometimes 8 of these implants in each arch, depending on how much support we need. And this helps reduce the bulk, reduce the size, and increase the stability of what would otherwise be standard old-fashioned dentures.
Yeah. Now, our third option is what everyone wants. They want to not have to remove their teeth out at night, correct?
Correct. And these are permanent teeth with permanent standard diameter implants. And basically, we place anywhere from 4 to 6 or sometimes more, depending on what we need. We don't necessarily have a fixed number. And this allows a prosthesis that looks like a fixed bridge,
Right.
something that does not come out.
But I think what we want to drill down to in this talk is what our basic denture is, okay? And not everyone can afford a fixed option. So we do a lot of basic dentures here. And I think an advantage of why you should come to us is that we have our own denture lab here. You have a great deal of experience placing implants. You get 4 implants with that package on the lower, correct?
Correct.
It's a smaller diameter implant. They work very well. However, there's limitations to this, correct?
There are always limitations. And we touched on basically stability and function. Do you want to take your teeth out at night? Do you want motion or movement?
There's no doubt going to be movement with this.
There is always movement with a standard denture because you're pressing a piece of acrylic onto a soft gum tissue, and there's always a little give.
This technique has been around for years. I call this my grandfather's denture. Not much has changed in this particular arena of dentistry, correct?
Correct. And again, it requires adhesive. It does cover the palate, so you may gag, you may have trouble swallowing. In some cases, it affects how you taste your food.
But again, we do a great job with this procedure and its limitations because we do have our own lab. You walk out the same day after extractions with teeth. So you could call this procedure a teeth in a day.
Right.
If you wanted to. And we do all the fits and retrofits after.
Correct. There is maintenance required.
That's right.
And that's one of the things that we'd like to touch on as well, is that dentures are not a fire and forget treatment.
Right.
We do require maintenance. We'd like for your health to come in and make sure that everything is being cleaned and monitored and maintained.
Yeah. Patients often come in and say to me, I just want all my teeth out and then I'll be done. That's not so true, is it?
Correct. Now, a denture is not going to decay.
Right.
But gum tissue is affected by anything that is not natural.
Right.
And bacteria or lack of maintenance or cleaning will cause irritation and may affect the fit of the denture. If we place implants, obviously we can even have the implants fail if they're not maintained.
Right. Right. That's true. So just because you have no teeth and you have implants, you still have to have those implants cleaned, preferably every 3 months.
Correct. Hygiene is very important, and we do enforce that, and it is part of our treatment.
Right, right. What I found clinically is that the dentures and all the prostheses look fantastic. It's about the function.
Correct, correct. And obviously, as we touched on, there is motion with certain of the types of dentures we use, and the more implants we add, the more stable the prosthesis becomes. And obviously with the fixed option, that's something that you won't remove at all. It functions more like natural teeth.